Welcome, everybody. My name is Jamie Harvey. I'm the executive director of PRATI, which is a organization, a virtual organization, but kind of really formed in Fort Collins by a bunch of prescribers and therapists who are really interested in helping transform the world. And we offer trainings in ketamine-assisted psychedelic ketamine-assisted psychotherapy. And our purpose is to restore connection to the secret, which we define as self, community, nature, and spirit. And the vision of PRATI is that we imagine a planet where all people flourish and thrive in right relationship with the natural world. And of course, that's a beautiful vision and one that really requires a lot of work because we're stuck in this crazy cultural narrative, paradigm now of hierarchy and power. And so the exploration that we're really trying to help facilitate and really move the needle on is not only internal transformation through our trainings, but external transformation of our societies. It's not about just being a little bit more resilient. It's about transformation. And so we're really excited, so excited to have Yaerlix Estrada on the call today from New York City. So welcome, Yaerlix, for our presentation on psychedelics and community mental health and transformation. And before I get going, maybe I'll just, it's kind of long, but I'm going to read through your bio just to do justice to your incredible, your history and work. And so I don't want to discount that. So Yaerlix is a first generation Central American drug policy and harm reduction researcher, community outreach worker for overdose prevention and psychedelic and a psychedelic community organizer. She currently works as a city research scientist with the New York City Department of Health and Mental Hygiene, conducting community-based substance use harm reduction, outreach, and research. She's also the director of the New York City Psychedelic Society, which works to help build a connection of psychedelic New Yorkers that is grounded in creating safe spaces. Yaerlix's work, both inside and outside of her formal profession, have been focused on elevating the needs and centering the voices of communities that have been most marginalized, impacted by colonization in the country. People use drugs, unhoused folks, low-income communities, BIPOC communities, and immigrant communities, with an emphasis for folks with many intersecting identities. She organizes psychedelic integration circles that are BIPOC only, with the intention of offering a safe space for community members to share their experiences that intersect with mental health issues in lieu of not having your own community and adequate institutional mental health support. She's on the board of directors of Tennessee Recovery Alliance, on the advisory board of the media group Symposia, and is a member of the Urban Survivors Union. She received her Master's of Science of Public Health in Health Policy at Johns Hopkins Bloomberg School of Public Health. And it's just an exciting honor to have you here with us here today, Yaerlix. So welcome, and I see more people have joined us. And just to begin, before we got on, I was sharing with Yaerlix how, in some ways, we're calling it a web conversation because it's a bit of a webinar and hopefully a conversation. And this is our second one. And if you happen to join us with Dr. Sam Gandhi last time, where we talked about nature relatedness and ecological grief, and the intent was to hold a bit of a conversation. We didn't get to that. Our hope is that maybe we can do that again today. And so we're kind of learning as we're going. So not only is Yaerlix a part of this little mini experiment, but you as audience members are as well. So thanks for being with us and joining us in this exploration, because our hope is that we can truly provide some content and some ideas and get folks thinking a little bit differently about the context of the work and how we can collectively move for broader cultural transformation. So So let's get going, right, Yaerlix? So in your bio, you said you organize psychedelic integration circles, and uh, just as a background, we actually are not 100% sure of the backgrounds and professions and lived experience of those on this call, but um, we do cater to a lot of therapists and prescribers. So my sense is we have a lot, but there may be also some general public out here. And the whole idea of integration is sort of a concept that was new to me about a year ago. But I was wondering if you could just sort of describe what you mean by a psychedelic integration circle, because it's, I think, maybe new for some individuals.
Sure. So hi everyone. It's nice to be able to share space with you. Yeah, so I guess I'll say why I thought I needed it once. So there many years ago I had an ayahuasca experience that it was wonderful, it was really helpful at the time, but it was also extremely disruptive in my life. I left the experience with a lot of heaviness and felt very lost. It felt like I was just like thrown into a new reality of my life that I wasn't ready to handle. And I started looking for resources where I was living at the time in Baltimore, and I couldn't find any. So it just really destabilized me in a lot of ways. And at the time, I started talking to different people about what resources we have as people who use psychedelics and that are going on that are having these experiences. And at that time, as someone who wasn't preparing properly and was very young and kind of being a little irresponsible with the way that I was experiencing psychedelics. Um, and at that point, it led me to start the Baltimore Psychedelic Society. And through that, I met someone called Catherine McLean, who was starting to do psychedelic integration circles in like the DMV area. And basically, it's a way of providing care, like mental health care for people that don't have that in an accessible and community oriented way. So now, it's 2022, it's a very different time. Like you can go online and potentially even like find a therapist that provides psychedelic integration. Um, but that process may be expensive, right? Like I've seen people charging like $200 an hour to provide that service, or sometimes even more than that, depending on if they accept insurance or not. But whenever somebody goes into a psychedelic experience, hopefully now that there's more information for people that are choosing to engage in that process, there's a preparation process where they're preparing themselves for that experience. But after, during the experience, a lot of things happen, a lot of difficult things can happen. And oftentimes people need a space that they can integrate what happened, whether it be good or bad, because if it was a good experience, there may be some potential lasting effects from that if there's proper integration. So I'll give the example that when I first started using psychedelics, I was extremely depressed. And I did have these moments of relief, of like feeling really good. And I wasn't providing any kind of like integration post my experience. So I would feel good after, and then I'd end up depressed 3 months later, because I wasn't properly integrating my experience. Um, so the psychedelic integration circles that we have and that a lot of people around the country are having, and maybe around the world at this point, there are spaces where people can get together and there's a facilitator, and the facilitator will, like make sure that there's equal time for people to share their experiences. And people in the circle will share like, oh, that happened to me as well, this is how I dealt with it. Or the facilitator will like share things that they find is helpful for the person in that moment. And I think what's really great about typically, well, at least what we do in our circles, is that it's not this kind of like, I'm a therapist that knows everything and I'm going to tell you. It's more of like, we're in this circle because everyone is an expert in their own lives and in their own experiences. And I may have had an experience, or I may be very well versed in a particular type of substance or a particular form of integration, whether that be like journaling or meditating or combining it with a spiritual practice, or community, sharing just community with people, being in physical space with one another. um, Everybody can provide a different perspective, and I think that that's really great. And the other thing that we have is the integration circles that we have tend to be specific to particular communities. So I organize psychedelic integration circles for people of color, so that we can talk about race without having to explain ourselves about why we're talking about race and the experiences that we have. And there's also psychedelic integration circles for trans and non-binary folks, so they can share their experiences with each other in a space that feels safe without having to explain themselves or without having to fear, like stigma or onlookers that might be trying to harm them in some way. So in a nutshell, that's what they are, and that's the approach that we have when we have ours.
Yeah, no, that's beautiful. Thank you, Nadita. Um, I think integration sort of intuitively makes sense, but it's a term that is in some ways, or again, was new to me. So, like, is this something that the New York Psychedelic Society offers, or is it something else? Or and maybe can you share a little bit more around how you became involved with the New York Psychedelic Society, and many states have these now, and sort of what the work is doing that's maybe different than sort of this evolving above ground infrastructure that's rapidly descending uh, on the country, on this country. Yeah.
Hmm. Yeah. Yeah. So I guess it started, like I mentioned, it started in Baltimore. The New York City Psychedelic Society does provide those services. We used to do them in person, and then once the pandemic hit, we moved online, which has been really great, as I'm sure you all know as well. Like, it's online is way more accessible, and you can have people from all over the country, all over the world, whoever wants to join in, um, come and experience these things. So we've had people from like Alabama, or places where there's no people of color doing psychedelics seemingly, be able to come to our calls and share with us, which has been really beautiful. Um, but the way that I got involved, like I mentioned earlier, like there was a time, okay, there's always been times where people have been using psychedelics, right? But I think that there's just uh, I don't know what changed, like around 2015 or so, that there were more people that were organizing around psychedelics in the way that they weren't being organized around previously. Um, so a lot of us around that time, 2015, 16, 17, started organizing around um, having places for people to get together and talk about their psychedelic experiences, and then started realizing, like, wow, a lot of us are getting healing around these substances. Um, and at that time, like, psychedelics were still very stigmatized. So like nowadays you can be like, yeah, I use mushrooms. People are like, oh my God, that's so cool. How did you use them? Like the conversations are very different. Where like a decade ago, or even maybe even like 6 years ago, if you said that, people were like, oh, you're doing hard drugs. Like, oh my God, like, how does that not impact your school or your work or whatever? Um, so I think the genesis of psychedelic societies in the beginning was just a place to give people support as they were, exploring their themselves with psychedelics, as well as for their own healing. And some people, it wasn't for their own healing; it was just like for fun, and to destigmatize these substances. And I think that it was separate from things like MAPS, because MAPS has always had their own mission to medicalize psychedelics. Um, and for a lot of us, that's not what the goal was. It was just like, we just want to be able to have this alternative method of mental health and like self-care that we didn't have before, in a place that was safe for the community. Um, I started organizing with the New York City Psychedelic Society when I moved here. And I also started organizing with the intention of not being politically ambiguous anymore, because the psychedelic space tends to be very politically ambiguous. Where if I started talking about the work that I did in overdose prevention, or if I started talking about, politics like genocide and colonialism and the harms of imperialism and things like that, people would look at me like, why are you talking about that here?
Hmm.
Like, we're just here to talk about acid or like whatever. Um, and so when I started organizing with the New York City Psychedelic Society, it was more so for the same purposes of, giving people an opportunity to learn about psychedelics, to have a safe space to integrate them, because just of the implied system that we're working in, that like I can't just go to a doctor and have them help me with my integration, or I can't afford to go to a ketamine clinic. So what options I have are either going underground with a guide or joining a ceremony or doing it myself, you know, in my apartment, using something and trying my best to make a container that feels safe for me to have that experience. But then I still have to go somewhere to receive help to integrate that. Like we can't really, people can integrate experiences on their own, but for me, I felt it's way more powerful to have a community of people to help me through that process.
Yeah.
So we're continuing that work in New York City, but we are much more targeted in who we want to help and why. And it tends to be people who don't have resources, who don't have access to healthcare, who don't typically have access to mental health care. Um, yeah, people like that.
Yeah, no, thank you. It was I don't know, interesting, but it's, you know, it's people, like, we're wired for connection. Humans are wired for connection, and it just seems intuitive that we come together in groups, and that we've always healed together in community because we're in relationship. We're all in a relationship, whether we believe it or not, and a culture says that we're alone, right? Because we're not alone. Um, um, and so I've been sort of just struck um, by this, like, I don't know, struck, but it's like we have this, you know, these terms that I hear around the underground movement and above ground or underground, and it feels as though what we're is being called is something that's a melding maybe of both, right? But mm, I don't know where I was going at necessarily, but that once again, there are a lot of people who are seeking healing, who've been traumatized by our system and don't have the resources, more often than not economic resources, but access in many different ways uh, for that healing. So yeah, and so in some ways it's a segue for in around harm reduction, because it's a term that's used quite frequently, and I was wondering if you're able to share a little bit more about uh, what harm reduction means for you and in the communities that you intersect with.
Yeah, sure. So harm reduction is the idea that we're all going to engage in risky behaviors and we have to just do things to keep ourselves safe as we're engaging with those risky behaviors. So for example, like driving fast in a car, like a lot of people do that, even though it's not legal. So wearing seatbelts is a way of doing harm reduction in that situation. Um, other like in other aspects of harm reduction is like in sexual health is using condoms to prevent like STIs. When I talk about harm reduction in my work, I talk about harm reduction specific to people who use drugs, and that is, you know, as I'm sure you all know, we're going through an overdose epidemic. Like last year, we lost 100,000 people to overdose, and most of those deaths were largely preventable. It's just like repeated system failures that we keep having these issues because of like antiquated drug wars and um, antiquated drug laws and systems of policing that put people at risk. But specific instances of harm reduction are like giving people clean syringes so that they can use if they're choosing to use, giving people naloxone or Narcan, the overdose reversal medication, so that if somebody does have an overdose and they can use that. There's a lot of adulteration that's happening right now with a drug called fentanyl, which is a really powerful opiate. And it, you know, we're finding it in things like cocaine and ketamine and MDMA and things like that. So giving people fentanyl test strips so that they can test their drugs and know what's in their substances is another method of harm reduction. And most recently, which is exciting in the last year, we've been able to implement in New York City a drug checking program with a higher technology machine so people can bring their drugs to us and we can let them know what's in it. And we also opened up 2 overdose prevention centers, otherwise known as safe injection facilities, but they're much more expansive than that because people can go and they can smoke in there, they can inject, they can sniff, they can, you know, any method that they want to consume their drugs, they can do that. Um, so those are kind of like concrete examples, but I'd say the definition that comes to mind for me is also radical love because we live in a society that stigmatizes people who use drugs so much for the, you know, for their use, and oftentimes we don't see how the system has put people in situations where, you know, that might be their only option for self-soothing or for self-care because all the other systems have failed them or have rejected them in some way. Um, and a lot of the people that end up in these situations, when I work with them and when I talk to them, are people who have been through really intense trauma, people who have lost a lot, people who have very severe mental health conditions. And so, you know, when I talk to the people that I talk to at my work or through my job, like there's a lot of people that I'm like, these are people that really need healing themselves, you know, and I don't often hear a lot about the intention of what we're going to do this to support them through their processes. So that's kind of what harm reduction is to me, and how it's connected to this larger work.
Yeah, no, thank you for that. I think recently I was at a gathering, and mm, there was a medicine person from Colombia, um, and I'll characterize it as he was laughing, but it was through some translation, but sort of laughing in a way, and as he described, sort of this white culture going down to South America to get to experience, you know, have a psychedelic experience, ayahuasca, or and 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 how sort of it gets into the words, sort of the terminology that's often used, like medicine, and and he was sharing how in their culture it was really the idea of a teacher. And I think we kind of, you know, the idea of a teacher and deep wisdom, spiritual wisdom, that is calling us to collectively heal. And why am I saying that now? Um, I think maybe that's the piece of the work, this work around psychedelics, which is, I think, less about the medicine itself, but more broadly, a bigger calling about how we heal in our communities as individuals, and as an ecological planet, which is similarly being ravaged. And so um, maybe I'm struck by radical love, because so much of that is about, I think, putting aside that judgment, or whatever it is, and seeing that intimate connection that we all share. Um, so of being connected to something bigger. But those are my words, obviously. um, So why don't you put together some slides, right? Why don't we take a couple of them, and sort of why don't you move through what feels comfortable for you? And we have a small audience today. We are recording the presentation, and if folks have a question, you can pop it into the chat. But really, what we're just trying to do is sort of elevate the conversation around um, mental health and psychedelics, and um, and what is required in a transformation of our culture. So feel free to do that. So does it feel like an okay time to you, Yaerlix, to
Sure.
pop some slides? Unless I brought up some things that, you know, feel free to challenge me or ask me some questions. So I just want to make sure that that's on the table too. So yeah.
Cool. Yeah. And yeah, again, I'll preface that like the presentation and the information is like based on my experience on the things that I mentioned earlier with my work. And I've sometimes heard people say that they don't see how this is relevant to psychedelics, and I think that that's why I choose to present on it, because everything is interconnected. Um, Even if people who are suffering differently than us are not connected to us, like we're still connected to them, and we have to think about other people outside of our regular situations. Um, so there's like a lot of like kind of dense material. I'm gonna go over the top of all of it, and then we can just like circle back if there's anything that we want to talk about specifically.
Beautiful. Thank you.
Okay, so whenever I do presentations, I always have a land acknowledgement. Um, I'm currently on the unceded territory of the Lenape people, also the Canarsie land. Um, because we live on colonized lands, and land acknowledgements are a small way to pay respects to the indigenous communities that lived here before us, even though and sometimes they're just performative because the people who are saying these land acknowledgements don't actually do anything about this. But it's helpful to at least acknowledge and think about what we can do to be proactive in our actions to support indigenous communities that were here before us. We already talked about who I am and why I talk about these things, so I don't have to do this again. Um, but a couple of things that I think is important that are kind of more, if we zoom out, is a lot of the things that I've talked about in terms of like the different barriers that specific marginalized people, they come from the history of our country, right? So it comes from colonization, how colonization caused genocide to the indigenous people that lived here, how slavery forcibly brought people from other countries, from Africa to this country in a way that they didn't want to, how a lot of Central Americans are here because of US imperialism, and how all of this is fueled by capitalism, how the world is being destroyed by like large corporations that continue to pollute the planet, but then they put the onus on individual people, tell us to take shorter showers, like things like that, that it just doesn't quite make sense. But colonization is fueled by capitalism, it's fueled by white supremacy and commodification. A lot of this is really intertwined with psychedelics and how there are people that are rediscovering psychedelics and their use as healing, and then putting a massive price tag next to it and saying that this is ours, that we came up with this, when that's not the case at all. And all of this has led to where we are today. And in the psychedelic space specifically, we see a lot of instances of racism, of patriarchy, of psychedelic exceptionalism, saying that people who use psychedelics or that psychedelics are better than other drugs. And I want people to, just think about that, about how that's not true, because a lot of American drug policy is based on being able to control and incarcerate people. And so we should be trying to destigmatize all drugs, legalizing all drug users so that we can stop over policing of people, specifically over policing of Black and Brown people. Um, Generally, I think something that's also important, especially in the context of psychedelics, of psychedelic healing, and this isn't specific to just the medicalization of psychedelics, but even in the underground, like I can't tell you how many times I felt uncomfortable trying to find a space to use psychedelics because there just isn't a lot of safe spaces for us to do that. And there's a growing number of specific spaces that are happening, but these problems are not specific just to medical spaces. So like marginalized communities continue to have lack of access to culturally competent, affordable, and accessible healthcare and mental health care. The current system that we have is carceral, it's racist, it's inequitable. How many times have we heard stories of people calling for a mental health check for a Black person and then they end up getting shot? It's just like these ways that the mental health care systems are supposed to respond, and they just end up really harming and continuing to harm people. Um, and of course, because I am a person of color and that this is my experience and like I know my community best, communities of color face specific issues regarding accessing mental health services, and psychedelic treatment is not doing a good job at not replicating these problems. And so um the psychedelic space is in several ways squeezing itself into the current mental health system, or at least trying to. And so, I think that it's important to recognize the issues that exist and how the issues that exist are an extension of everything that I talked about previously. Um, around how like people were diagnosed with mental health conditions just to control them, like how schizophrenia was labeled as a violent disorder when Black people were given freedom, in the 1960s and things like that. Um, and so I think in general, there's a really great need to just know these things and think about how we move forward with that knowledge, so that there can be more accessible methods of healing, of treatment, whether if it's above ground or underground. Um, and that there needs to be more of a way to integrate harm reduction and overdose prevention into mental health care, and moving away from punitive systems that include policing. And so this is, again, more so of the work that I was talking about, but it's really intertwined in a lot of our work and a lot of our lives, just knowing the number of people who have passed away in this past year. Um, yeah, there's a lot of people. I don't know anyone who doesn't know someone who knows someone that hasn't died of an overdose or at least experienced an overdose. And so, um, as we're thinking about what healing looks like, I think it's important to consider all the types of people that might be looking for healing, and what happens when they don't have that kind of access. So this slide and the next slide is specific to the work that I do in New York City. Um, we've engaged lots of folks around that use drugs, particularly use injection drugs in public spaces, and asked them what issues it was that they had, and what systemic barriers they had, including housing instability, criminal justice system involvement, and stigma. And 67% of them needed a place to live, 33% of them needed a government ID, 27% stated that they had all of their needs met. And we didn't go that deep into asking about like mental health and healthcare access and things like that, but it just goes to show how many people in our community have high need, and what it means as we're thinking about psychedelics and psychedelics for healing, what it even means to heal if people don't have places to live, if people don't have places to feel safe, if people don't have their basic needs met, and what it is that we're doing to elevate this and to change the conversation around like what healing means if so many people don't have access to the basic things that they need to feel safe. And on top of that, a lot of the people that we talked to were constantly harassed by police, again, had issues with criminal justice involvement, because of the fact that they use drugs, and experienced different levels of trauma at the hands of police violence, um, which continues to be a major detractor from our work. So I just think it's important to name the harms that have happened in our community at the hands of police, particularly with people who use drugs. And so, in general, the next couple of slides are just kind of what I advise people to think about, to hopefully have a framework around how they do their work or how they're thinking about psychedelics, because psychedelics are not just this, standalone single issue. It's this like really beautiful and complex, uh, intelligent resource, and so much more than that we can use for a lot of different ways, and I think that um, healing is obviously like an all-encompassing word that we can use for when we talk about psychedelics, but I think like thinking about what healing means and like what does it mean to heal the world. Does it mean I'm going to use psychedelics for myself, and once I feel better, I'm going to go back to work and I'm going to work for this venture capitalist that's paying, using my funds to pay a mining industry that's destroying like half of the Amazon? Like, no, that's not what we're going to do. We're going to think about like how our actions intersect with all of the other folks that are marginalized and that need that healing as well. And so some of the groups that I talk about or that I reference are people in the drug policy movement, like working to stop mass incarceration due to drug use, given that like psychedelics are also drugs and they're still illegal. Indigenous sovereignty, acknowledging where the histories that we come from these lands, and the need for reparations in these communities, abolishing the police, housing justice, climate justice, advocating for universal health care, and also thinking of the folks that are often marginalized in our communities, like Black folks, immigrants, LGBTQ communities, sex workers, disabled folks, um, and just thinking creatively about how we are working together in allyship, right? Because I think oftentimes, like I've been in the psychedelic space for like 6 years now, not super long, but longer than some other people that have been in it. And when I've brought up conversations like this to them, they're just like, well, why would I stop the progress that I'm doing for, these other people? And it's such a stark response of like, well, why do I care about your life? Is what I'm hearing. Um, and so I think whenever there's someone that's not in the room, or whenever there's someone that we're not thinking about, whether it be like in our own organizing or in our own practices, think about like what is it that's not making this accessible for other folks, and what we can do to make it more accessible, and to at least hear the perspectives of others, but making it so that it's not putting the burden on someone else. Because something that has happened as well is having people ask me to repeat my experience over and over again for free, and that's also not right. I'm not doing free education. I think that it's important to build real relationships with people, and get people to trust you, and then like have a reciprocal relationship, which is not easy to do. All this takes time. um, I'm not going to talk about this. I kind of talked about it a bit already. But some of the things, so I have two last slides. The first is more of for general, like self-reflection. The second is more so for providers and for people who may have practices, or for may be in some kind of provider role. But I would say for people that maybe if some of this information that I'm sharing sounds new, or if it feels uncomfortable, um, thinking about, just learning more about the history of this country, learning about um, the different created structural barriers like redlining and things like that exist and have been intentionally made to put a lot of us in these positions. And then thinking about our own identities and how they interact with, um, the structural world that we're living in. As I've had so many people say, well, I don't have privilege because I'm XYZ. And it's like, no, maybe you just need to think about that a bit more. Um, and how there maybe the lack of barriers has led to you being able to do certain things with your life. And then part of that is acknowledging your own privilege and examining your own biases. And then that's internal work. That's work that if you're engaged in this process, it's hard. Like I'm in my own processes. I recognize that I have a lot of privilege. Um, and being able to hear other people give feedback and learn about how I can change and be more supportive of others is a process that never ends. Um, but other things that we can do is educate ourselves, question a lot of the things that we hear, because a lot of the things that we hear are lies, especially now in this age of fake news. It's a strange time. Um, but talking to friends, family, community members, learning to have difficult conversations about some of these topics, educating others, advocating in whatever way that you can, whether that be through an organization that you can get plugged into, or if it's through your own work, learning how to shift the needle on some of the structural inequities that exist. Um, and then some of these other more specific things, looking for direct action, supporting protest, looking into abolition measures, respecting people of color only spaces, and of course taking care of yourself, because it's a tiring time. It's very easy to get burned out, but we can't get anything done if we're all sick. So if we all do a little while we're taking care of ourselves and we work together, we can accomplish a lot. And then for providers, this is kind of thinking about um, just some of the things that I talked about the structural inequities that exist in mental health care and the healthcare system. But and this is easier said than done. I'm not a provider. I don't know what this actually means. I just talk to other providers about what it looks like for them. But striving for accessible, affordable, and flexible treatment options, or like whatever it is that I guess it's called treatment across the board. So yeah, that prioritizing patient autonomy and treatment plans that are restorative for them. So some people have said that, the first thing that happens when they go to a mental health care session or looking for help is that they get a diagnosis on something. They get put in this box. And then they're like, oh, okay, well, it sounds like you're depressed. So here's some antidepressants. I'll see you in 6 weeks, and some people don't want that, and I think that's why we're all here, because we're looking for other alternatives. But the psychedelic above ground mental health system is squeezing itself into psychiatric system that exists in this country, that has this kind of paternalistic view of how to treat people. So I think it's important to be able to encourage people to have their own autonomy, to talk about what their goals are, what they would like their outcomes to be, how they would like their lives to change and to flourish. And I think that would be helpful as we're thinking about how the above ground mental health care, like psychedelic care treatment, moves along. And again, these are the same things that I mentioned earlier. So acknowledge the system that we're working within and why we're here. I think we all have individual communities. We all have power in our individual positions to at least have these conversations. And if we have higher positions of power, thinking about how we can shift to supporting people who don't often have a lot of support. Um, like in my job, like I'm a low level government worker, but I've advocated for things that have led to like little systemic changes, and like little systemic changes are big changes, because they impact so many people. And so I think we can all do something like that, and it takes a lot of work, it takes a lot of resilience, but I think that as long as people are not okay with the status quo and being like, oh cool, psychedelics are in the mainstream, I'm so excited, then there's more that can be done. um, and lastly, this is just my own, I mean, it shouldn't be just my own, but advocating for and utilizing harm reduction strategies in the work that we do, especially if we know people who use drugs or we work in the mental health care system, advocating for more local drug checking in our communities, and for safe supply options, because, the drug supply is killing us and we need better. I think having different stakeholders in the community that can speak to that is always helpful. So I'm going to stop sharing there.
Thank
And
thank
yeah,
you,
you're ready.
Yarlix. Yeah,
Mhm.
I was on mute, so I'm looking at this question. It's fun. I know Jennifer, so welcome, Jennifer, and hello. I will say I appreciated the way you did frame your land acknowledgement, because I, for one, have just found they have been so performative, as you said, and I think it's like, so what, right? In some ways, without a context, like, what are you going to do with that land, and how are you going to help things? But there was something about the gift that is coming from this land of knowledge, and in many ways there is so much, not many ways, I think that's where all our wisdom really comes from, and the teaching of the land, and our interconnection to it, not only as that we're all natural living beings in relationship. But I'm just wondering if folks have any specific questions for Yaerlix, and feel free to put them in the chat. Um,
I can
and
respond to something that I saw from JCBL or BI,
Jennifer, yeah.
Jennifer. Yeah. Yeah, is I feel like I often get this question of like, how can I make my space more inclusive or more whatever? And I think um, two simple things, which aren't that simple, it takes work, is one is to put people in positions of leadership that you want to be reflected in your community. Because like, I, for example, like when I was finding a therapist, I wanted a Hispanic woman to be my therapist. I don't want anybody else, because I don't feel like anybody else really understands my unique experience, obviously. And it wasn't easy to find her because there aren't that many. Um, and same in like our organization, like in the New York City Psychedelic Society, it initially was run by two white passing men. They were like, one is Puerto Rican and one is Brazilian, but like when you look at them, they're just like white dudes, right? And so when I went to their events, it was all white people that were there, mainly white men. And I was like, oh no, like, do I want to join this organization where like this is the representation that's showing up? But they told me like, just organize with us. And I set out my conditions of like, you're not going to hold, we're, you can't silence me no matter what awful things I say. And they're just like, okay, fine, we're ready for it. And I came in and I started organizing with them. And maybe within 6 months, we had like the most diverse set of people. Like we had people of color and queer people and women, and people that felt really comfortable showing up to that space because that's what I cultivated in that space. Um, and right now, my two friends that I organized with before, they are no longer organizing just because they've moved on to different things in their lives. But the current set of organizers are myself, a Black artist, that, brings his own energy, and a trans queer South Asian person that also, they bring their own energy as well. And so we've been able to cultivate this like really beautiful community that reaches out to so many other kinds of people that we wouldn't have been able to had I just, decided to keep it very homogenous. So that's one thing. The other thing is to pay the diverse people that you want to be present in organizations to show up, and they will bring other people potentially. So it's yeah.
Um, Thanks, Yarelix. Boy, I had so many questions that were just coming up in my head, and now they're flying out the window. Um, just making sure that folks have an opportunity to weigh in. I was wondering, if you're able to speak to the difference between decrim and legalization, because I think it touches on, or to further sort of to elevate that a little bit, because it touches on, I think, this idea of underground and who has sort of the right to use these medicines. Is that something that you can speak to a little bit, Yarelix?
Yeah, sure. Yeah, so it's complicated. There's like the general framework, but then, there's the bills, right? And the bills that come out are very specific, and can differ widely from one region to another. But generally, decriminalization, especially psychedelic decriminalization as it's been happening, is well, what has been happening with psychedelics isn't necessarily complete decriminalization. It's been deprioritizing funds from the police so that people aren't prosecuted for the use, sell, or distribution of psychedelics, like in the decrim nature kind of framework. Um, Proper decriminalization means that there will be no um, like criminal penalties for use of whatever, like let's say in the specific of drugs. Um, but in some instances, there can still be fines. And so, it depends jurisdiction to jurisdiction how that's carried out. But at least the person isn't going to go to jail. Like in worst situation, they might get a ticket. Um, and in decriminalization, there's typically not a framework for distribution, regulation, things like that. So what we're seeing now is there's the decriminalization of psychedelics, for example. There's like, like I'm someone who grows mushrooms, and then I have people come to my house and like we do ceremonies together, and that's typically like that's not it's decriminalized. People can do that. Um, but it depends on what's happening at the state level. It depends on what's happening at the federal level. There have been situations where the feds have gone and raided particular places because they know that there's a large amount of whatever drug that's present there. Whereas with legalization, which typically happens at the state level, whereas decriminalization can happen at the state or the city or even the local level. Legalization tends to happen at the state level, and if someday maybe the federal level. But it's a way of creating regulation and like rules around how things are done. So like psilocybin was legalized in Oregon under a specific kind of framework that they have. Um, and so that's different, right? Because it's legal at the state level, and then there's also like a pathway in which that's done. Um, and we can think about like cannabis, for example, where like cannabis is legal and anyone can, well, I don't want to say anybody can distribute because not everyone can distribute. Um, there can sometimes be situations where legalization, depending on the language that's used, can actually be more limiting than decriminalization because it says like only these people can use these substances in this particular way. Um, but there can be ways to legalize things that they don't have to be that way. Um, but legalization, because it's above ground, tends to also be beneficial for providers like therapists and doctors and things like that because they can use that as part of their practice. Whereas when it's kept decriminalized and it tends to stay underground, which gives more flexibility to the underground, like people who may not have all these credentials, or people who are credentialed but are just doing this work, not
in
using their
community.
medical
Yeah.
licenses and things like that. Yeah.
Yeah, no, it's interesting because like PRATI uses a, a medicine that's used off-label, ketamine, in our trainings. And we can only do that because it's the only legal medicine that we can work with right now. But even now, we have nurses that come into our training who they're not therapists. Right, and we have prescribers who can prescribe the medicine. So you have the therapists and the prescribers, but these nurses themselves are in this sort of in between world, right? In that they bring when you think of what they bring to this work, is that they hold space for those at life transitions, giving birth and at death, and bring years of like that deep experience, professional experience at holding space and really trying in difficult times. But in our current system as of now, they don't fit, if you will. And our shared friend Quasi, I know, has been working with Penn State and the nursing school there to sort of help elevate the role of nurses in the psychedelic space.
Mm.
But I think it's sort of these sort of tricky blurring of lines between this underground and above ground, and how we do how we move forward is I don't know, it's sort of interesting and tricky and challenging, but would also for me is as if we can follow that teacher, the teachings in the medicine, then we'll be on a better path. I know I'm kind of rambling here, but
No, you're good.
I know when we tend to chat offline, it just leads to beautiful places. Um, I'm also making sure that there's some time for, as we come close to a close, if there's any specific questions that people might have around helping support communities. One of the things that we've introduced at PRATI is we in our trainings, we have a component of our training that's dedicated to what we call reconnecting with life, which basically provides a framework which is on our about page, which was understanding that we are interconnected from ourselves to our communities, to nature, and to something bigger. And the idea that as one has a transformative experience with psychedelic medicine, that there's sort of that one becomes radicalized, and we become radicals. That's the word with the E on it, which is the embryonic seed root. And so how do we plant these seeds, right? This new way of thinking, and into our communities, but create the support systems for those therapists and prescribers coming through our training to connect with and support. And it's happening, of course, but how do we make it happen faster with the work that's happening in sort of in the underground, right? Because we really do have to blend that legal side with what's happening in community, because really the healing needs to happen holistically. So Jennifer has a question: how can we bring the concept of integration circles into a more formal therapeutic model?
Yeah. I mean, I don't know what group therapy is like. I've never been to it. Um, but I do know that there are, outside of, I don't know how this would work in terms of like billing and things like that, but there are, doctors and therapists that host their own integration circles. And it's unclear to me if they, do that as a part of insurance, or if they just do that because they want to do it themselves. Um, the psychedelic integration circles that I host, with my co-partners, we do it for free. We do it for free or for donations. So people can come and, pay nothing, or people can pay $5, or the maximum that we offer as a donation is $10. Um, because we don't, you know, we don't want people to feel like they have to pay more than that unless they want to. So you know, we offer that, but there are other people that have different models of offering that. And um, like we, in the framework that we use, because myself and one of the other folks that helps co-facilitate the spaces, we've been working with internal family systems as a framework of kind of integrating the experiences that we have. So that's the framework that we tend to kind of go off of when somebody offers something that they might need support on. But you know, every therapist or every person that has their own framework can bring that into a space and still provide that support as a facilitator. But I think the role of integration circles is also to let other people, because it feels good to offer support, you know what I mean? Like, even if like there's a circle happening and someone who's not a therapist is like, hey, this really worked, this really helped me, in that moment when the person says that to someone else, that might be healing for them, because they're like, you know, when I really needed help, I didn't have that, but now that I went through this really difficult experience, I can tell someone else, and that might be really healing for them, even more so than maybe them receiving their own advice or receiving like advice from someone else. So I think like both having the ability to facilitate spaces and also the ability to bring your own experience as a therapist or, you know, healer or whatever, that's really helpful. But just creating the space for people to get together is also really healing and really helpful.
I think the idea of reminding people that they're not alone, because I think so often we're the culture where we're in tends to tell us that we are, right? But we're not, right? We're not. I know my wife leads some groups on pain. And it's just been this beautiful transformative experience, not only for her, but as a as a physician, but also for the people involved. It's really beautiful. PRATI is going to be putting together in sort of in the midst of it, some training around groups, just because the power of groups, whether with medicine or not, is healing in of itself. And so to Jennifer, bringing that question, and there we go. Here's a question. Here's something from John. But that the power of groups, and especially, it's a way to also increase access, because it helps reduce costs. If there's a fee structure associated with it, it also helps decrease costs if it's being done together. So. So some important work. John, we'll make sure to share the recording with you. Absolutely. We see your, so John is doing some work and doing some bi-weekly integration circles here in Colorado Springs. So with close ties to the DCRIM local. So very exciting, John. I'm recognizing that we have lives outside of this webinar, and also so do want to honor those lives, so we can enjoy the rest of the weekend. But thanks for your question, Jennifer and John, and for the rest of you showing up today. We will have this recorded and we'll be happy to share it. Again, I want to close. Anything you want to end with, Yaerlix, before we do an official little close? But anything you wanted to share or add before we?
No, just it was nice to be able to be with all of you here today, and you know, it makes me happy that there's already people thinking about creative ways to do this work. So that's encouraging, and I hope that we all continue to do what we can in our own spheres.
We got to do it together, right? Yeah. All right. Well, everyone, thanks again for joining this conversation on psychedelics, community mental health, transformation, and big gratitude to you, Yaerlix, for being here with us on this Sunday morning, Sunday noon. So we'll end the call here. So tune in for our next webinars. Next one is on with Dr. Joe Tafur on spirituality and psychedelics. And we also have a training on case reports in developing case reports with psychedelics. So thanks, everyone. And we'll see you next time.
Bye. Thanks.
Bye now.